I think that was one of the differentials with MCIA, Josh, and I guess that's some of the experience that I could bring from working with industry organisations across a whole range of different sectors. Is that I guess we took a little bit longer to form, but governance was really key to that, and so we didn't actually launch until we until we'd had good dialogue with a number of people. We'd set up an appropriate structure, appropriate constitution to govern that structure. And but also very much, I guess, a principle of that focus was to get the involvement of the companies or members in our activities. So we do have a board, obviously, which Peter and Carol are members of, but we have a network of working groups that the members, not only full members, but our associate members and individuals are involved in those working groups. And so we develop our policy very much from a grassroots up in terms of the policy positions. That all goes to the board to be formalised. So, yeah, the governance structure is very strong.
Peter, I'll just start from the left. Peter, if you want to kick us off, and then we'll go down the line.
Sure. G'day, Josh. Yeah, so Peter Crock, I'm CEO of Can Group, and joined back in March or April. It was April 2016, just after the legislation had come into being for medicinal cannabis in Australia, and then as one of we were the first to be issued with a license from the Office of Drug Control when it came into effect back in February 2017. And not long after that, we started discussions with other early industry license holders about setting up the MCIA. And I've been chairman of the MCIA since we founded that over 2 years ago. So that's my background.
And Rosemary?
Sure, Josh. So I'm currently executive manager of MCIA. My background's more out of the sort of ag side, so more, so more ag tech, ag trade background, but along association or long involvement in industry associations. So I got involved in the medicinal cannabis industry through some early work with one of the licensed producers, helping them with some business planning work. And then through that, asked to help them set up the association, given my involvement in industry associations. So helped them do some planning work, and then sort of fell into the executive manager role, and been there since the start, I guess.
Great. And Carol?
Yeah, we all do a bit of falling, don't we, Rosemary? So I'm from a very different background, Joshua. I'm a non-profit CEO, Epilepsy Action Australia. I've been with them for a long time now. I'm not saying how many years, a long time, representing consumers. And back in 2014, our consumers started demanding information about medicinal cannabis as a treatment option. So that's how, I guess, our interest was piqued. We taught ourselves a lot about medicinal cannabis, trying to meet our consumers' needs, and just travelling along the way, I got involved in a few things, participating as a steering committee member of some New South Wales-based government trials, getting involved with another industry association called Medical Cannabis Council, and ultimately wanting to bring together, Medical Cannabis Council's work with MCIA's work, and I also serve on Minister Hunt's Advisory Council as well.
I saw your focus is mostly backed on patients and that connection to patients more so than the other two. The other two seems to be more industry focused. Yeah.
Correct. Although, as I said, I've been involved in the Medical Cannabis Council, an industry association, for several years, for 3 years, and so a real interest in trying to bring the two industry bodies together as a unified voice. But yes, at heart, it's consumer or patient needs that's the driver for me.
I had a real interest because I saw. I started off the industry in 2014, actually, in the U.S. And I saw the industry have in Washington State, there was 5 different industry organizations kind of all competing and having different outlooks on the industry. And they finally all laid down their arms and joined as what's called the Cannabis Alliance. And so seeing that, I had a recommendation to the MCC 6 or 8 months ago, whenever that was, to say, hey, shouldn't these organizations try to fight as one and make change at the federal and state level? I think it's a much more organized approach. Not to focus on that too much, but just very interesting that you guys joined up, but then a faction of you guys kind of split off again. So it's kind of disjointed again. So I feel like there wasn't too much progress there.
Yeah, look, that's unfortunate, Joshua. So we were listening. Some of us were listening when you were giving that advice. And, you know, for the last couple of years, I've been in conversation with Rosemary and with Peter and thinking that one voice was better, you know, was better than two voices or three voices, or, as you say, in the States, 5 voices. And the governments here, particularly the Australian government, are very familiar with what happened in the States. And they were very positive when I talked with them about MCC and MCIA coming together. Now, look, you can't do anything about splintering and people that decide to do their own thing. There's really nothing you can do about that. But when you look at the objects of MCC and MCIA, and I believe also this new group, the AMCA, we are really all trying to do the same thing. You know, we may have slightly different motivations and different viewpoints, but we are trying to do the same thing. So I don't think it works in our favour to have different voices. I think, you know, one solid, unified voice is the way to go.
Well, it just provides a nice backdrop for the regulators to communicate and get industry insight. And you don't want 5 voices in there trying to have a say. You just want to be able to go to one. And I think you can progress a lot faster and farther if you can go to that one voice.
Yeah, agreed. And I think, you know, MCIA has proven itself to be well managed. Rosemary, you can close your ears, you know, around this. Rosemary is known as a good operator. I think Peter's ethics are you know, obvious and well known. And I think MCIA is an obvious leader. I would hope at some stage there will be back to one organisation. But certainly that's where the MCC sits at the moment.
So I guess I've had a look at the MCIA and this MCC integration. It seems like the MCCIA or the MCIA is more focused on the cultivators and the manufacturers rather than the greater industry. Am I correct on that? Or is it starting to transition a little bit more to other avenues and ancillary businesses and things like that?
No, look, I think our objectives have always been to represent the industry broadly. Certainly, you know, the license holders are a key part of that industry, but their focus has always been around, you know, ensuring that patients have you know, products, Australian quality products, and at affordable prices. And so certainly, you know, we've tried to engage the whole of the industry in all of the, you know, narrative and conversations that we've had. And I think we're getting, you know, better at that. Cannabis that we held earlier this year, I think, was the first sort of really dedicated industry conference for medicinal cannabis. And yeah, the feedback from that was very, very positive. And we had starting to get that involvement with the patients and the healthcare sector, and I think that will only grow from there. And we've got a couple of initiatives in train, which will hopefully cement that sort of sector further into MCIA. But our objectives are industry wide.
Gotcha.
And Joshua, I would say I wouldn't be involved if I thought that the focus was as narrow as you perhaps sort of suggested there. I wouldn't be involved. I think my conversations with MCIA have very much been around patient access, quality, safety standards for patients' benefits. And and I think you'll see the membership changing a little bit to reflect that.
I think that's really reassuring. I think because there's so many other ancillary businesses that are based on this industry that can help and try to push it forward. And so people like myself or a lot of these other organizations that aren't necessarily licensed cultivators or manufacturers or doing the R&D like Peter would like to have a say and would like to help push it forward and become help Australia become a world leader in this space.
And I think that's just a measure of the maturity of the industry, is that it is brand new. The fact that we had as a starting point the licensed operators through the ODC process, we realised that we needed to provide a voice back to the regulator so it wasn't seen as an individual company push. And that's now going to expand, as you're saying, to a broader area. But it's really interesting as the first licence holder, we obviously had a lot of dialogue with the regulator early on in the piece, but there was no doubt that wearing an industry association hat where they knew that they were talking to an industry association, the dialogue was very different to how it was as an individual company. And that's the advantage of pulling us together. So we've started with a nucleation centre that got started, but it's now going to expand, and I think we're seeing that happen rapidly, and that's the opportunity ahead of us.
Do you see yourself, so do you guys have a formal structure to the organization so far? Is there something being set up where it's more of an industry organization where you would have elected officials or anything like that? Do you have any vision on that yet, or is that something you're working on, or is there a thought process behind any of that?
I think that was one of the differentials with MCIA, Josh, and I guess, that's some of the experience that I could bring from working with industry organisations across a whole range of different sectors, is that, I guess we took a little bit longer to form, but governance was really key to that. And so we didn't actually launch until we, until we'd had good dialogue with a number of people. We'd set up an appropriate structure, appropriate constitution to govern that structure. And but also very much, I guess, a principle of that focus was to get the involvement of the companies or members in our activities. So we do have a board, obviously, which Peter and Carol are members of, but we have a network of working groups that the members, not only full members, but our associate members and individuals are involved in those working groups. And so we develop our policy very much from a grassroots up in terms of the policy positions. That all goes to the board to be formalised. So, yeah, the governance structure is very strong.
And I guess, Peter, this is kind of a controversial question, I guess, but being one of the leaders, Can Group, I know Can Group a little bit. I've had dealings with a few of your employees, actually. Your COO,
Shane Duncan, that's
Shane,
right.
And
Yep.
I've talked with Sophie a few times.
Yep.
Can Group is quite a large organization within Australia, publicly listed. Is there a conflict between running an organization or being, not a semi-head, but a figurehead within the MCIA, and, your own outlook on Can Group?
No, look, I think the key thing, and for me, the approach doesn't vary in that the ethics of what we're doing as an industry association is underpinned by what we're doing as Can Group. We were actually the first medicinal cannabis company to list on the ASX through the front door. So we did an IPO, and back in 2017, just after we'd received our license. At the time, the ASX had decided that that too many reverse takeovers had occurred where the business model wasn't exactly clear, and we've been very clear from day one what our approach was going to be. And in establishing and setting a standard and working to that is a really important part of it. So, yes, as an industry leader, and Can was the first to be issued with a license, but we've done everything properly through the front door and setting a standard. So that's really important that we continue to maintain that, and that's the same position. And I've had great support within the board of the MCIA that we take that same approach. So having a legitimate industry voice is absolutely critical, and that's where we're working with all of the industry participants to ensure that that standard is well understood. So our standards subcommittee is one of the most active and important groups within the organisation that is helping set that standard and understand a code of conduct under which we're going to operate. And it's difficult times, in terms of even down to things like the advertising standards of the TGA, and making sure our members are well aware of what those requirements are, and without being punitive, showing them the right direction and setting those standards is part of what we do. So, yeah, I don't see a conflict between the two, and it's because we are holding to that standard that at the end of the day gives patients in Australia confidence that they know what they're getting, how they're getting it, and it's being done for the right reasons.
So I guess that's a good segue into what, what is your priorities as an organization right now? Like, what are you trying to fight for, and where are you guys headed? What things are you currently lobbying for, and how are you attacking federal and state level?
Well, how are we approaching federal and state level? We're not attacking, but we are providing an active voice back to them to draw attention to some needs. And there's no doubt there still is a lot of frustration, and in terms of the number of people who are still turning to the black market or accessing products that we know don't meet the Australian requirements is disconcerting. So in terms of us having an agenda to try and improve that patient access is really the primary driver behind everything. The federal approach and working with Minister Hunt and his team through to understand what's happening in the TGA and the ODC, the Office of Drug Control. We've long held the position that it's an under-resourced and overworked organisation, and we're working actively to try and bring that to the attention of the Finance Department, for example, where we're looking for fees that are levied by the Office of Drug Control currently go into consolidated revenue and are not fed back into that department to help them in their position. So, it sounds simple, but even drawing attention to those things are part of what we're doing, and working with them in a way where we know legislative change is going to be slow and take time, particularly in this COVID environment. So finding ways to work through that don't require a legislative change, but improve the performance and access to patients is part of what we're doing. Rosemary, do you want to add to that?
Yeah, and I think the other key, so obviously, a key priority has to date been a lot around the different regulatory processes and the reviews, and certainly, the Senate review is very important, and there's a number of activities that come out of that we're now supporting, and I guess one of the other key things that we see is around the education. So we see education for doctors and for the healthcare sector is really important. So we've got a few initiatives that we're working on to try and see if we can leverage some support of the broader medical professions to help build that education and understanding. And certainly Carol can speak a little bit about some of the work that her organisation has been doing, which is fantastic in building some resources. Obviously, you'd be aware there's the current discussion around the CBD scheduling. That's obviously sort of been a key activity for us in the short term. But longer term, I think it's about really trying to build that leadership for the industry. And as Peter mentioned, our code of conduct, we're really behind trying to ensure that there's a legitimate, credible industry that has a set of standards about ensuring Australian quality, which is we know has an advantage not only for Australian patients but globally. That Australian quality is being produced to the right standards and patients can access that. Longer term, affordability is a big issue, and that means getting access to PBS or some sort of subsidisation system for patients. Again, it's all, as Peter said, it's all about ensuring safety by ensuring that patients have access to products that's produced by a licensed player, so that we know a lot of the black product off the black market doesn't have the same safety standards for patients, and that's obviously a major concern. So it's very much about trying to build that platform where patients can have the access to products produced under a set of safety and efficacy standards. So look, we've got a suite of activities that we're trying to do. It's a new organisation. Resources are always tight, but it's certainly. I think getting the right regulatory environment, getting the education, building the education resources, and then ensuring that the industry is operationalised to be able to produce, product to Australian standards is really important. And I say not just domestically, but also for export markets as well. But Carol, you might want to talk about the education side.
Yeah. I'm not saying anything new here at all, Joshua. The Senate inquiry and what Rosemary has just said. There are two things that stick out, and it's in terms of patients, and it's cost and it's education. Or even willingness to prescribe, willingness to prescribe and understanding of how to prescribe at the doctor level. Now, I guess everyone's saying it. I can say it because I actually speak to hundreds of patients. Our organisation speaks to thousands of patients all the time. And there is still a really concerning number of patients that are receiving, black market or green market product. And we don't believe that's what should be happening. But when you come down to why, it's either the response they got when they first raised it with their doctor, or it's the cost of the product when they actually go to source the product, particularly when you're talking about paediatric epilepsy where the doses required are quite high. So there are a range of activities. I mean, Epilepsy Action, for instance, is bringing to the table and talking with MCIA and MCC about education for doctors, but that education has got to be delivered in a way that's simple and available to them when they want it, not going along to courses that are 2 hours or half a day or whatever. So we're actually working on some initiatives that will take that education directly to doctors, and even just being a helpline, being somebody that can be called when the doctor's not quite sure. I mean, I've got one request this week that we're working on. GP wanting to prescribe, not quite sure how. Okay, we're at the end of the phone and we can talk with you. We've got trained professionals involved. So whole range of activities. And with MCIA, we've got an initiative currently in play to try and bring together a patient-doctor advisory group that can, give that direct input in a more formalised way to MCIA.
I think education and communication is probably key, especially when you go on the TGA website. I mean, it's just a cluster of just too much information, right? And so any type of simplicity to dub it down for those guys that are already inundated with long days and things like that, I think would go a long way.
I think that's right, Joshua. It's all there. It's actually, there's lots of information out there. It's all there, but are the doctors actually going to, take the time to actually find what they need? It's almost impossible. So you're right. We're talking about bite-sized pieces of information delivered at the right time in the right way.
I saw, I'm going back a little bit to the money factor. So kind of this money that's being generated by the ODC you mentioned. Same thing happened in the US. A lot of that money was going into a slush fund, and then as it was being taxed, but it didn't make its way back to the regulators necessarily. So ensuring that money gets back to the regulators. And then also, have you guys thought about possibly a taxation on the product to help drive the industry forward? I felt like in the US, it really didn't get too much attention until the regulators saw that there was going to be this great benefit and money generator for them and for general, taxes. Is that something that you guys are interested in, or?
Look, I think at this stage, the resourcing question for the Office of Drug Control is the key one. In terms of finding an equivalent to the pharmaceutical benefits scheme is probably more on the agenda than taxing revenue from the space. So if they looked at the value of, it was Fiona Patton in her, she was on a webinar just a week or so ago, said that the black market in Victoria, she'd been told by Victoria Police, was $10 billion for cannabis in Victoria. That's where if you could tax that sort of revenue or have that revenue go through the right pathways would make a difference. But that's an aside that or a whole different discussion. But I think in terms of to start with, getting the resourcing right and ensuring that the system can actually function properly and efficiently. What has happened in the way that the special access scheme, as you know, you're probably well aware, but it's quite a progressive way of introducing medicinal cannabis as an unregistered product. So it's given us the ability to have product that's available and to generate revenue in what normally wouldn't be the case, but for a developing drug. So it's been useful in that regard, but it's now streamlining it further and making it both time and cost effective for patients and doctors to be able to service through that is the key. And then for the industry players themselves, ensuring that they've got certainty and a line of sight around how they can process or have their applications, whether they be licenses or permits, processed in a timely and effective manner by the Office of Drug Control is the other part for the industry.
Gotcha. I think those are good initiatives, but I do feel like regulators do want to see money back into their system. Once you get that set up, they're going to definitely, they just don't see the benefits of it until they see actually money generated for them. I know they're getting some money from, you know, these applications and things of that nature, but a steady stream of income, I think the government loves to see dollars on the board, you know. I guess it's just like any other organization.
I think one of the other things that we're trying to do, I think one of the challenges that we've got, and we've been trying to talk to the government, we need to look at the industry more holistically than just that. And so we're currently at the moment working with an organisation around developing a report for the industry. And I guess at the end of the day, if you add up the contribution that the industry is making in healthcare, the potential benefits to the healthcare system from savings that from moving people to a more benign medicine, like medicinal cannabis. You look at the jobs being created, the growth in regional areas, potential export income. The industry has potential to be a considerable contribution to the economy and to people's well-being, and to jobs. And so I think that's our push to the industry, to government, is to look at the industry holistically and say this industry has a huge benefit. And right back, if you look at the other end in terms of the R&D, Australia is well known for its med tech and ag tech investments. We have a real potential for, and this is, I think, for state governments particularly, very interested in leveraging some of the benefits of the infrastructure they've built around med tech, particularly for this sector, which means it's good news for patients because we've got more R&D happening here, but it's also income coming in, investors coming in, bringing income in to invest in that R&D, and then potentially commercialisation of that R&D outside of Australia. So I think discussion isn't around just taxation. It's around what's the benefit of this sector long term, not only for patients but for the healthcare sector and then for the economy more generally.
So I guess going to that point, as far as rescheduling, how do you see that playing out? I think it's just in a few days, correct?
Yes, a couple of days, yep.
Do you see that being descheduled down to a 3?
Look, I'm not going to predict what TGA will do, but look, I think there's generally strong support for relaxation around CBD as a product. I guess we MCIA has put a submission into the initial process, and we'll probably we'll definitely be putting a follow-up one in. We're currently having some work done by an organisation to help inform our decision making. But I think the major issue that we saw with the TGA proposal was that the low dose is going to make it very hard for products to still come through that pathway. So it's going to be very difficult for products to get registered through the S3 pathway at the low dose level that the TGA has recommended. So I think there's strong support for down scheduling CBD, but we need to make sure that it's done in a way that's practical and actually going to deliver some benefits at the other end. So I think that's where our focus is at the moment, is trying to develop up what's a practical approach so we actually have a real pathway for products to get through the system. And
how do you feel that descheduling would affect the industry if that does go through?
Oh, look at this. Or Peter might like to answer that a bit.
Yeah, no, look, I think the real question is the process of registering an S3 could still take 2 years for companies to build an efficacy package around it. And the fact that they've chosen a dose level that's ostensibly safe, at the same time it shows that in most cases it's not efficacious. So that's the real issue there, is that it's a nonsensical limit that's been set, and we've argued that needs to be reviewed before they do, or that's our view anyway, is to push back on that. So the fact that it's opening up and potentially making easier access for patients, we absolutely believe that that's a positive step, but it's got to be for the right reasons and make sure that it doesn't preclude us from being able to actually register something and show that it is efficacious. So, but yeah, cannabidiol will be important and is a key part of where things are going. But the whole range of cannabinoids that are coming through, and as a new class of compound in medicine, really exciting future ahead of us. And that, as Rosemary said, is the super exciting part of what we have here as a footprint or a capability in Australia around both the ag tech and med tech research that will take us in that direction. So, yeah, any scheduling changes on the way through will be useful, and as long as they're handled appropriately, will be good for the industry. But it's not. It definitely, as it first came out, it was sort of lauded that we were going to have open slather from calendar year 2021 with this having been achieved. No, that isn't going to be the answer, and people will be really disappointed. So trying to avoid that disappointment and keep a system in place that allows us to progress. But yeah, the future's exciting nonetheless, and these are all parts of the process, and it's where having an industry voice is really important in that, so that it's not one company that's trying to argue a particular point or for a commercial outcome. This is all about patient access, and if we can get that happening in the right fashion, that's what we're trying to shape this with our input.
You're right, Rosemary, is that I think R&D in Australia is probably the strong point of the Australian system. Is there a push for you guys at all to possibly try to brand that product that is produced domestically on the worldwide market as a Australian-made, homegrown, green, whatever you want to call it? Are you thinking about trying to create a brand behind Australia to be able to open up those export markets?
Yeah, look, I think, I guess we haven't articulated it quite in those words, but I think certainly our code of conduct, and happy to share a copy with you, or it's on our website. You'll see there that we've certainly defined Australian quality. So we certainly want Australian quality to mean a certain set of values for patient, or for everyone, for the community, for government, and certainly in export markets, that Australian quality is something that we see will give us an edge in export markets. So we can comply with European GMP, and certainly if we can translate those same values to patients globally, then that is that will certainly should give the Australian industry a bit of an edge. So at this stage, I guess it's more about it's sort of baby steps. So we've defined what we think the values are for Australian quality. We're now making, we put a code together to make sure that at least all of our members are producing to to those values. And then once we, have that confidence and the transparency around that part of the system, then I think we can really go out and promote that longer term. So yeah, we do see that package is really important for Australia.
And I guess what's on the other side of that, besides the export market, what about the importing market? Do you feel that there needs to be a change of the current manufacturers or importers bringing in product that isn't meeting the same, specifications of local domestic producers and cultivators and manufacturers?
I think it's been a common message from us to the regulators is imports need to meet equivalent standards. So we imports are part of the industry, and at the moment, a very important part of the industry because we don't have a lot of the Australian production. But we are very keen, it certainly is very much important to us that the compliance through the regulator, through TGA, is there to ensure that those imported products come in, meet the equivalent standards to Australian products. So and I think, TGA, I think, is increasing its level of surveillance and monitoring around that compliance. It certainly was a problem. I think, there certainly were some challenges identified early on, but there still is a huge range of products coming in, and I guess there's also pathways that are not as transparent with that people can order off websites and etc. So look, imports. They are part of the industry currently. Hopefully over time, Australian product does win its share of the market that we predict it's going to. But I think the key thing is just making sure that imports meet the equivalent standards to Australian products, and that is enforced by our regulators.
Yeah, I think it's pretty tough because the current black market and grey market, they're kind of just popping up anywhere, anywhere from farmers markets to, you just don't know where this stuff is really coming from. And I think it just needs to be taxed and regulated. But I don't think the general, consumer even knows how to go about that. I mean, they go to my website and ask me all the time, where, can I get product from you?
Yeah.
And it's just kind of crazy. You have to point them to, just go to your doctor, go talk to your doctor. And I'm sure they can help you, but generally the doctor can't really help them or isn't informed on helping them. So I think it's very tough on
I'm sure Carol can make some comments around that. Yeah.
Patients are really, really frustrated because we are all giving them that advice to go to your doctor. Go along to your doctor. I mean, even if the doctor doesn't prescribe, asking the doctor is in fact raising awareness. So we do say that. But the majority of people are still saying, my doctor either doesn't want to know about it, doesn't understand how to prescribe. I think a lot of the doctors are waiting for the medical bodies to take more of a stance. The Royal Australian College of General Practitioners, the AMA, and even the more specialised bodies like the Epilepsy Society of Australia, they're not out there in any proactive way at the moment. And I think a lot of the doctors are waiting for those signs.
I guess, is there, I guess on your side, are you guys trying to reach out to some of those organizations and unite them in any way?
Absolutely.
We're trying every day.
Absolutely. I mean, as Rosemary said, there are a number of initiatives underway, and including our plans to try and create an advisory body with key medical professionals and so on, and we will be reaching out more to them. Yeah.
As far as one of the major points, I guess, for actual consumers is the ability to then go drive and not get any infringement once you do start to consume. Is that something you're focused on? I know in the States there's a number of breathalyzers they're trying to implement to police to help monitor this situation. There's some tech companies that lots of funding that are trying to solve that issue. But it is an issue, and I know that on other drugs that have opiate, heritage, those come under a special scheme that they give them. They give those products a little bit of leeway when consuming those and then driving.
I think the issue is the legislation currently requires that if there is cannabinoids detected, then the police are obliged to charge the driver. And so in all cases, driving under the influence, whether it's detection versus impairment, which is the big issue. So if you are taking opiates, clearly the package says do not operate heavy machinery or drive when under the influence of this, but that's different to being in the presence of. And the issue with most, I think all of the states, is that driving, if cannabis is detected in your system, then the police are obliged to charge you, and that's where So I know Fiona Patton's been working heavily on that in the Victorian legislation review, and it did come up in the Senate inquiry as well, I'm sure, is that, yes, it needs to be, the legislation needs to be adapted so that people clearly can't drive if they're impaired in any way, and that's standard to any medicine that they take. We want medicinal cannabis to be in that category, that clearly you're not to drive if impaired, but because it remains in the system for so long, detection doesn't equal impairment, and that's where we've got to try and find the way to break that nexus.
And that's state by state legislation as well. I think every state has to implement their own legislation behind that.
Yep, I think you're right.
And I think Victoria, I mean, you guys are just so much more down the road ahead of, I think, New South Wales and especially Queensland. I was just living in Queensland before this, and Queensland has no idea what's going on, in my opinion. They're not really clued into that it's federally legal. There's all these other legislation with industrial hemp, and it's just very fractured from state by state here, very much like the US. I mean, you have 50 states in the US, but here you only have 7. You would think that those 7 would be able to communicate a little bit better.
So one of the initiatives that we have just established or worked with the Parliament to establish federally, Josh, is a parliamentary friends group for medicinal cannabis. So that group is now being formally constituted under Parliament. Obviously, activities of that group's been limited through COVID, but what we are hoping is that we can at least help build awareness and education. And driving, I think, is this issue around driving is one of those issues that we can bring a level of awareness amongst all of the parliamentarians, and then when they go back into their own electorates across all of the states, hopefully we can start to build some consistency in the messages that go back. So that's certainly something that we see as is hopefully going to be a very helpful group for this industry, because there's been enormous support across all of the parties, all the major parties and the independents in terms of signing up to the Parliamentary Friends Group for Medicinal Cannabis. And I think these sorts of issues where we're getting these inconsistencies across states, if we can build up that education and people go back into their electorates and listen to their own, because they're all hearing it, I think, from their grassroots residents. If we can start to build up that knowledge base, and hopefully that can trickle through to get some better policy at both state and federal level.
I think that education, but just proper communication of that education, I think is key, not just to industry, but to everybody that you can. And there's these different people that need to be targeted with different information. And so if you can somehow filter that through that and drive that down into these different bodies and different things to try to get it to who needs it, there's just a lot of information, and it's very hard. But if you can, even you guys, I didn't even know. I knew MCIA, I knew there was an industry body, but I don't know what you're working on. I don't know what your positions are. So that's one of the reasons to have you on and really understand that information that you guys have in there and where you guys are headed. Because I think the industry wants to know, consumers want to know, the doctors want to know, and it's very hard to convey all those little details of the industry to the people that need it. So do you have events coming up, or how are you attacking the communication going forward? Is there a formal plan behind that?
Yeah, so again, we've been sort of building resources in that area. We did host a cannabis at the beginning of this year, which was a major platform for us, in not just for the conference itself, but also then to spin off more activity into social media and other media areas, and so hopefully we'll start to see more of that over the next few months. And we do plan to hold a cannabis again in March next year. Obviously at this stage likely to be a virtual or a hybrid virtual. I think even March next year we're still a bit away from having large groups of people together, but we certainly want to keep that platform going through that way. We also do have member events from time to time. So again, that's probably historically been built more around when we've accessed visiting experts from overseas. Out here in Australia, we've built an event around it, but so we need to look at doing things differently. And again, with COVID's changed the way that we've had to interact with our members. So we're just about to start member engagement sessions with the board. So at the end of each board meeting, we'll have a half-hour session where members will be able to come and interact with the board and ask questions and build up that engagement through the members. Initiatives like Carol's mentioned with trying to set up the advisory group for the healthcare patient sector. So hopefully over the next I think over the next sort of 6 to 12 months you'll see a lot more activity from us in the broader media. I guess we've spent a lot of time getting everything lined up. As I said to you right at the beginning, we wanted to make sure we did things the right way with the right governance. So and we've had a lot of big policy issues to deal with ever since we had the Narcotics Act review, and then we had the Senate inquiry, and now the CBD. So there's been a lot of big policy issues to deal with along the way. So probably cannabis was probably the start of our major communication platform, and then hopefully you'll see a lot more activity from us post that. But always happy to come and talk to people like yourselves on these sorts of opportunities. And I think it's a great opportunity to get our voice out wider, because we obviously don't know everyone in the space, and it is a very diverse space. So it's great to be able to communicate with people like yourself to let people know what we are doing. And if people want to join us, we're really happy to have anyone join us as well.
And is there a front person? Rosemary, are you the kind of front person, the person interacting with all these organizations and get to know them?
Yeah, look, I guess, normally I am the front person. Our board is very active. I think, like a lot of industry organisations when they get started, huge amount of voluntary time and resources. I think, our member companies put in a lot of voluntary time to helping out and representing MCIA at various events and meetings, etc. So, whilst, I'm the person people get if they ring the organisation. We do. The board is very, very active itself, and Peter, certainly speaks at a lot of things on behalf of the organisation.
As far as the MCIA, both the MCC and the MCIA both have medical in their names. Is the focus to keep this a medical focused industry, or is there an outlook to eventually make this more recreational or descheduled industry here in Australia?
Our position is that it is purely medical focused, and in fact the whole idea of a legalised market detracts from establishing and we've seen this, looking at what's happened in the US and Canada. It really distracts from the real value of medicinal cannabis and that we see that as the key focus for Australia, is to really establish and have it well established, because and looking over the ditch, New Zealand as well is really interesting. As soon as it comes into the mix, it really starts to take people's attention away from what should be all about making sure people are getting access to, patients are getting access to a well qualified medicinal product. And that whole recreation, the idea, there aren't any real patients who are interested in self-medicating with a recreational product. They would much prefer to have a medical product. And whilst and that's the opportunity we've got here in a really focused environment, we'll get far more traction and headway in establishing the medical use of cannabis as medicinal cannabis than if the whole argument comes in around legalisation and decriminalisation. Just doesn't help in the mix. So no, we're very much focused on encouraging the development of a true medicinal cannabis solution for Australian patients, and that is best done in a well-regulated and well-defined environment.
And Joshua, that's an area where MCC and MCIA are absolutely aligned.
Gotcha. But then there's this kind of this overlap with this nutraceutical side, right? Like there's the medical side, but then there is other sectors to this industry kind of coming out of the industrial hemp or coming the other way. Do you see does the nutraceutical and the medical side, do those overlap, or are they two separate things? Or
yeah, look, they're interesting in that I think they are two separate things. And again, if you look at the US and what's happened over there, the FDA are now trying to crack down on some of the CBD, craziness that's occurring in the US market, where everything from coffee to nail polish has CBD in it, and there are people that have rushed in to make a lot of money in that space, which only in America, of course, they're doing. So, so no, the problem will be that if it can really impact us, where people say, no, this is all snake oil, and we lose real traction where it's being driven for the wrong reasons if we're not careful. So I think that's where there does have to be a delineation, and moving to a down scheduling where it's a safe dose but known to be largely ineffective as well is the slippery slide of getting into a space where of course it's safe at that level, but that's because it's not doing anything at that level, and you end up with a real question mark about whether it actually has an application in medicine or not, and we don't want to end up in that space. So that's where, if it's done for the right reasons, absolutely would support a down scheduling, but if it's done just because it's safe and easier to put it into that category, no, that doesn't help us at all, because people will say, yeah, no, this is just rubbish.
I think the FDA just came this last week or two, and they've adopted the same model as here. So they cut out that whole CBD market, as far as what I saw, and they're bringing it back to the same situation as Australia has. So I found that very interesting. Obviously, there's still the recreational market, which is state by state, but on the federal level, they've cut out that nutraceutical side of the industry. Is there, Carol, I didn't get to hear too much from you. Is there anything else you'd like to add to the conversation, or to continue on from what we've talked about?
Yeah. No, look, Joshua, I think I had, a bit to say where it was relevant. Obviously, in terms of the industry knowledge, Rosemary and Peter have that well covered. And as I said, I've got kind of a couple of hats, one being bringing together MCC and MCIA. And I think that's moving along very positively. And the other is to make sure that the patient's views are represented. And I think I've had every opportunity to talk about that. In what you were just discussing then, it was interesting, my colleagues at the Lambert Initiative once a long time ago drew up a model for me, which was recreational, what they called well-being, rather than nutraceutical, well-being or lifestyle, and then medicinal. And I think, certainly in terms of both Epilepsy Action and Medical Cannabis Council, we are interested in this as a medicine. There's no doubt about it. So I just wanted to emphasise that. And as I say, the MCC and MCIA are aligned on many, many, many fronts, but this is certainly one of them.
Yeah, it's because you start to get these byproducts and things like that once you start producing the medical side of the industry. I mean, a lot of that, instead of wasting product, you could use that for other industrial purposes, and that's why I ask if there's other sections in the industry. I know there's industrial hemp. It's kind of, they're all subsectioned out, but there is a lot of overlap, and there's a lot of even domestic cultivators that are sourcing their product from the industrial hemp market. And so there is this intertwined market. Some people want to admit it, some people don't, but there is a lot of overlap in the industry. And so the reason I ask is because to get those people involved in those other organizations, let's say on the industrial hemp, there's IHA, they might have some say on where their industry lies and where it comes up to, and then where you guys take over.
Yeah. And I think we absolutely acknowledge those other parts of this broader industry. Acknowledge, and I would also acknowledge that we all have individual opinions too when it comes to the various issues, say around recreational. use. But the important thing for MCIA, I think, and for MCC is to have a focus, and that focus is about patients and quality product for medical reasons.
Of course. And I think it's well positioned for Australia as well, like we already talked about. So yes, definitely, I think that's a great model. Rosemary, do you have anything to add?
Oh, not really, Josh. I think we've had a good conversation. I mean, it is early days. The industry is maturing. I mean, I think some of the issues that we've raised are not 100% specific to talking about the industry association side, and not 100% specific to medicinal cannabis. Other industries go through the same thing as the industries mature and come to a point of view. But I think, there is certainly from an MCIA point of view, I think we are very clear about what we are trying to achieve here. And I think, just like to leave that message at one of the things that, we would like to see the industry seen as very much as that whole holistic benefit to the whole, to not just to the health sector, but also to the economy. So there's huge potential in this industry, in terms of both patient wellbeing, but also in terms of being a great sector for Australia to grow on the back of. So I think, it's very exciting, but we do need to make sure that we move it at the appropriate pace so that we get things done in the right way. And I think there's lots of learnings that we can take from some of those other examples around the world, or things that we don't want to do. And, I think we might be a little bit late to the party in some respects, but I think what it does is gives us a great opportunity to make sure we've learnt from some of those lessons and we do things the right way to ensure that we do have a really good and strong industry that will endure.
No, definitely. And Peter?
Yeah, look, I echo both Carol and Rosemary there in terms of the focus. I think is really a key thing here, in that whilst you can get distracted with and having positions around legalisation and other things, that's all noise. At the end of the day, we want to be focused on getting product available to patients in a cost-effective manner, and you need an industry-based, solid industry base to do that. So in the right framework, we'll get there, and it'll make a difference for all patients and internationally as well. Great standing out of Australia, and that we're looking to leverage as well. But it starts with a real focus around the medicinal cannabis space and the patient. So that's just rounds out exactly what we've said there.
And the MCC and the MCIA, is there a plan to unify those underneath one banner, MCIA, or will it be MCC, or it's still kind of operating on both?
Yeah, it's still operating on both at the moment, but most of our activity is joint activity right now, and we'll go back to the membership base and the board and relook at that as time goes on. We put the first collaboration in place and said there would be reviews, and those reviews will be soon. We'll be looking at them this year and again early next year, and we'll determine what the next proper steps are.
And is there I guess, can the industry, I'll be sending this off sometime next week. Can the industry be expecting kind of a newsletter or a communication channel to them that they can read up on the next initiative, or is there a general meeting or anything of that nature?
Yeah, there's a general meeting, isn't there, scheduled, Rosemary? And
our AGM is in October. But as I said, for the members, we are initiating as of this month the member engagement sessions with the board, so that will kick off on our next board meeting. And we certainly send out member updates at least monthly, and more if there's something newsy to tell them. But members certainly get a member update every month. And as I said previously, I think you'll start to see a little bit more general media from us as well. So hoping to we're putting in place at the moment some arrangements to try and be more proactive, I guess, in terms of the social media and general communications, industry conversation that's happening out there outside of MCIA membership.
Yeah, like I said, I think that's the easiest way to capitalize, I think, on the industry domestically, is just a communication. It's just so much noise filtering through all the online stuff, and trying to find that direction is probably where you can really make headway.
Yeah, I agree.
But I just wanted to thank you guys for coming on and spending an hour with me. I know it's everybody's busy, especially in these times, and I really appreciate you guys providing your insight. And I hope you guys enjoy it when I send it out next week.
Oh, excellent.
Terrific. Well
Thanks,
done, Josh. Thank you.
Appreciate
Thank
the
you guys.
opportunity. Okay,
Thanks,
thank you.
Josh.
Okay.
Appreciate it.
See you all.
Bye,
Have a
everyone.
good one. Bye.